will be doing Compazine.
Compazine. Okay. We need a 20 to 23 gauge needle, a 1 to 1 1/2 inch needle length, and then we use a 1 to 3 milliliter syringe, and the sites are ventral and dorsal gluteal, and if the medication is less than 1 ml, then we could use the deltoids. All right. Hand hygiene. Provide privacy. Hello, good morning. My name is Brian. I'm a Rio Hondo student nurse. How are we doing today?
Good.
Good to hear. Before we start, I need to ask for your name and date of birth. Can you please provide that for me?
Yes, Angel Pena, 03-15-85.
Thank you very much. And then any allergies that should be made aware of?
Yes, I'm allergic to penicillin.
Penicillin. We'll keep you away from penicillin, but the doctor did prescribe you some Compazine. Compazine, the purpose of Compazine is to take care of your nausea and vomiting. Two side effects include dry constipation and dry mouth. Knowing these side effects, are you okay with me giving you this med?
Yes.
Okay. I do gotta ask you 2 questions for my assessments. Have you been experiencing nausea and vomiting today?
Yes, I threw up this morning and I'm very nauseous still.
Okay, I'm sorry to hear that. Definitely this medication will help you with it. So in that case, I'll be right back, okay?
Okay.
Alrighty. So I hand hygiene out the patient's room. Hand hygiene into the medication room. So I'm gonna do my first med check. We're gonna be giving my patient Angel Pena Compazine 5 milligrams intramuscularly as needed for his nausea and vomiting. And then right now it is 12:50. So we're gonna be taking out my Compazine. Let's see here. So this is Compazine. This vial is not, ampule is not expired. So now I'm gonna do my second med check. We have here my patient Angel Pena. We're gonna be giving him Compazine 5 milligrams intramuscularly as needed for his nausea and vomiting. And right now it's 12:50. Awesome. So I just want to do some quick medication math. The order says 5 milligrams and the vial says 10 milligrams per 2 ml. So in that case, we're going to be giving him 1 ml today. Let's see here. I'm going to need a filter needle. And then 1 to 3 milliliter syringe. And this is a 21 gauge needle. And then I'll hand hygiene out the medication room. And actually, before I forget, 2, 3 alcohol pads. Now I'm gonna hand hygiene out the medication room. So now, knock. Hand hygiene, pull the curtain. All right, I am back. Before I start with anything, I just want to verify your name and date of birth. Can you please do so?
Yes, Angel Pena, 03-15-85.
Awesome, thank you very much. I'm gonna get your Compazine ready for you. Okay, so first thing I want to do is swirl the ampule. If there's any medication that's left on top, just want to get it all the way to the bottom. And then you just like a little motion. Looks like all the medication is all the way in the bottom. I'm going to open up everything. Okay. Now, I'm going to be administering this on your right deltoid. So go ahead and lift up your sleeve for me. Awesome. So I'm just preparing the deltoid. Okay. So the ampule is swirled. I'm going to then point this away from the patient and away from me. I'm gonna break it away from me. Okay. Immediately I'm gonna dispose of this into the pharmaceutical waste. Okay. Now I'm gonna get my 1 to 3 milliliter syringe and my filter needle. I'm not going to draw any air for this medication. I'm going to avoid touching any glass. Going to go straight through the middle. Perfect. And I'm drawing 1 ml of Compazine. This down. I'm going to first draw. Gonna scoop this using the scooping method. I'm just getting rid of any bubbles. Okay. I'm gonna ask Professor to make sure it's good. So I'm drawing 1 ml for this patient. Alrighty, in that case, get rid of the filter needle. Set it down to the side. I'm gonna use my 21 gauge needle, connect that. Okay, so now that I have my medication, I'm gonna do my third med check. I have here my patient Angel Pena. We're gonna be giving him his Compazine, 5 milligrams intramuscularly as needed. Actually, you know what? Let me make sure I have my med in my hand. So I have here my patient Angel Pena. We're gonna be giving him Compazine 5 milligrams. That came out to 1 ml. This is 1 ml. Intramuscularly as needed for his nausea and vomiting. And right now it is 12:50. So we'll administer that right now. First, I'm just gonna grab some gloves. Okay, so I did wipe the area with alcohol already. Okay, since I already wiped the area with alcohol, his right deltoid, you're gonna feel a slight pinch. Okay, I'm gonna use Z-Tech. Z-Tech. And then I'm gonna administer 90 degrees. Immediately I'm gonna put on safety. Put on this one. Okay. Immediately dispose of this. Awesome. So safety needle, filter needle and the Compazine, I'm gonna dispose of it in the pharmaceutical waste. Okay. Tap in the trash. Okay, Mr. Pena, I'm gonna be coming back in about 30 minutes to reassess for your nausea and vomiting. Do you have any questions for me?
No.
No? Okay. In that case, I'll be back. Use your call light. If you need anything, call me. So then I'm gonna document and then hand hygiene, okay?